My name is Danny, and I am the patient care coordinator here at Therapy Works in Vibrant Health Solutions. We are here today with James Quinn,
Hey everybody.
doctor of physical therapy, and we are talking about hip pain and injury. So, to start us off, hip pain is one of the top five most common conditions we treat here. Why is it so common?
It is it's a big joint. It takes a lot of pressure. It's really hard to do anything without loading the hip joint. I mean, your shoulder, I can be like, oh, I'm not going to use my shoulder for a day and let it rest. Our hips, we can't do anything. You can't even get up and down out of a chair. It is a complex joint. There are a lot of muscles that cross the hip joint. Um, and it is a deep ball and socket joint with 180 degrees of movement in all planes here. So, because of just how complex it is, it definitely has issues. Easy to have
Yes,
issues.
yes. Okay. Yeah, and I've had hip pain myself. So I've had two hip surgeries, and I know how
I didn't
complex
even
it
know
is.
that.
It is,
Dang, Danny, what are you
yeah,
doing?
so
Okay.
really complex, and I totally get that. So what are the most common reasons for hip pain?
Usually muscle imbalance. So because it's such a complex joint, and there are so many massive muscles that cross the hips. You know, we have our hamstrings, our quads, our glutes, and we're talking some of the biggest muscles in the body. If there is an imbalance or a weakness over time because of how much we use that hip joint, it's going to result in pain. Now that may show up in different ways. For some people, it might be a bursitis, or for some people, it might be early kind of hip degeneration or hip stiffness. But in general, the root cause is that muscle imbalance, that weakness that starts to set in over time. It's a common problem nowadays because we all sit too much. Just
Yes.
spoiler alert, but that is a it's a big issue. That's why we get atrophy, especially in the big power muscles like our glutes, because we all are stuck sitting. And,
Yes, unfortunately. So
I know, work and stuff.
yes. Okay, so when someone is experiencing hip pain, what are some stretches that help most often?
So as far as stiffness and stretches, two of the big ones, and probably the two biggest ones that I have almost everyone come. Now, it's not 100% of people. Obviously, we'd have to really get in and do some tests to know exactly where your limitations are and where the restrictions are. But I would say, by and large, hip flexors is going to be
Right.
number one. It's a big muscle that travels to the front. Again, we all sit so much, and we never, because of that excess sitting, it's constantly shortened. So it gets tight and it starts to limit range of motion, especially with full standing and full stride length. And then it pulls on that hip and changes the mechanics. So a hip flexor stretch is a big one. The easiest way to do that is just let a hip kind of drop off the side of a table. That's a pretty light stretch, not very aggressive. You may be able to look up like a standing hip flexor stretch or a kneeling hip flexor stretch. Again, that hip flexor is in the front of the body right here. I don't know if you can see me. You can't see me. So we got to stand. You got to get that hip into extension. Oh my goodness. It's
We did our best.
there's some little box on our screen, guys, so I can't see my whole screen. But it's in the front. So you want to get that hip in extension to get that muscle stretch. So it's right here and travels down to the anterior hip.
Great.
The second biggest one would be piriformis stretch.
Mm-hmm.
That's just so correlated with back pain, and it's around, kind of gets compressed on because of the power muscles of the glutes. So it controls hip rotation. So a piriformis stretch is rotation of the hip, crossing one leg over the other.
Yeah, those have really helped me.
Yeah.
So
Sorry, they're so hard to describe on a video.
if you're having issues, just come in. We'll help you out.
Hip flexor, piriformis. There's a lot of pictures online too. So hip flexor and piriformis, definitely big stretches.
Awesome. Okay, so what about exercises or motions to help improve hip pain?
So we going back to the most common weaknesses. would be often glutes are a big one, right? So
Big.
again, because they atrophy because we're sitting. A lot of times it's the glute med even more than the glute max, which is a little bit on the side of the hip, and that controls lateral movement of the hip or the hip moving away from the body. It may not seem like we do that a lot at first thought, but really it's important to stabilize this in every single step we take. It keeps the body from having to shift left and right. So if I would encourage everyone, I honestly, it's probably one of the most commonly weak muscles I see in the body systemically. So even if you're not having any pain today, I would encourage you to be working on lateral hip movements. The easiest ones are a side lying leg lift, where you're laying on your side, lifting the leg up and down sideways, or a clamshell, which is a common exercise a lot of people might have heard of.
Right.
Getting into more complicated things would be like a lateral band walk, which is a great exercise. And if you're somebody who loves to work out, I would encourage you to have that in your routine somewhere. Even if it's just more of a warm-up than a super aggressive lift. Definitely important. So that's almost my number 1 and 2 because of how important it is.
Yeah.
I mean, and so any one of those versions or all of them. I think the clams, the hip abductions, and the band walks are 3 big ones that I would have in somebody's program coming in.
Awesome. Okay. What are some good ways to avoid hip pain or injury?
So identifying those weaknesses, being aware of them, and staying strong and mobile. Now that may be a little easier said than done, right? Because we don't all know where our weaknesses are. We don't all know where our tightnesses are. But if you do, and you're like, man, every time I try to put my shoe on, I really can't. My hip doesn't move on this right side. It's hard to put my shoe on. Well, that means your hip rotators are tight. You know, if we can't sit down and lean forward because you get a lot of anterior hip pain, that probably means your hip flexors are tight, right? So we identify these limitations, and I think the key is don't ignore them, right? It's not normal to have those limitations, so you got to hone in on those, and if there's limitation there, stretch. If you feel that there's weakness, a lot of shifting in gait or trouble getting up and down, sit to stand, I mean, that's glute weakness. If there's weakness present and you're aware of it, don't just let it go forever, because it will get worse over time. These things don't get better. Like the car we don't want to take in. You're like, it'll just go away. That noise will just go away. It never works that way.
It doesn't go.
Yeah, it doesn't go away. All too often. Sometimes we get lucky, but most of the time it's better to have it kind of addressed.
Yes, and I completely agree. So lots of people have hip pain. How do I know if it's bad enough for physical therapy?
If you're even questioning it, it's probably bad enough for physical therapy. I think everybody thinks like, oh man, I hear this way too often in evaluations. Like, so if it's somebody's first day, we call that an evaluation. They come in, I take measurements, strength, range of motion, activity tolerance, things like that. And I hear it too often. It's like, oh, I'm really not that bad. I probably don't even need to be here. You probably need to be here.
You probably do.
Right. That's just the fact of the matter. And I always tell people, no, that's when you do want to come in. It's not worth waiting until you have crippling pain or crippling disability. You want to be in. You want to be that person that only has 2 out of 10 pain, and there's only a couple times you notice it, because that makes it really easy to take care of, very easy to address. Maybe it'll only take a couple weeks of stretching, strengthening, and a focused program to take care of it. If you let that go forever, or a year or 6 months, and it just keeps getting worse, the longer it goes, the more problem you have. There can actually be underlying degeneration that's taking place, being an acceleration of arthritis because of weakness, breaking down of tissue, accelerating of bursitis. I mean, all these things can get exponentially worse over time if they're not addressed, and it's so much easier to address early on. I'm so thankful when I see somebody with near no pain when they come in. I'm like, this is going to be a home run. We're going to knock this out of the park. You're going to feel better in 3 weeks. So yes, if you're questioning it, if you're watching this video and you're not sure how to identify where your weaknesses and your strengths are and what to attack, it probably means you should stop on in and say hi at least. Maybe we can give you some good pointers.
Awesome. Okay, so lots of great advice. Anything else you'd like to add before we sign off?
Guys, we do offer free screens, which means like if you're watching this and you're like, I don't know, you could always come in and we can do, just chat with you in person to see if it's worth doing.
Right.
Like a full series of treatments. But again, if you're at that point where you're even considering coming in, it's probably worth doing some treatment. I'll just say that that's most of the time what we find in a free screen, because it was worrisome enough to come in the door. It's probably worth treating. Stay moving. I think that's the most important thing.
Yeah.
I most of the time, if we stop moving, things just get worse. So there's are exceptions to that rule, but stay moving, stay healthy, keep stretching, keep working out. All these things are good for you. Find somebody who can help you out if you have any questions about specific things, because it's always worth addressing the problems before they get worse.
Yes. Yes. Awesome. Well, thanks so much, James, for being here with us today.
Yeah.
And we also have a complimentary consultation day on May 25th. So a whole day dedicated to free screens. So you can give us a call. We'll get you a slot. It's completely free. So just come on in. We'll talk with you a little bit about whatever pain you're experiencing and see if we can help get some solutions for you. So thank you so much for joining us today. Have a great Wednesday evening. Bye.
Bye, everybody. Sorry for my terrible exercise descriptions.